My name is Santiago Calderon. I am a mental strength coach here at Camuwave Performance. Today, I'm going to introduce you to my 4 tips on how to get through physical therapy program. Suffering an injury and going through physical therapy can be a difficult process, and different feelings like frustration, boredom, and sometimes fear do arise, which can cause you to not go through the physical therapy program as strong or as dedicated as you could have, and sometimes it costs you to drop out of this. This is why it's very critical to be prepared and to have some guidance during this time. And that's why I'm going to provide you with 4 tips to help you get through this process with more awareness, more confidence, and less fear. First tip is to sit down with your physical therapist or athletic trainer and set some goals, some expectations, possible barriers, and action plans. By setting goals, you will know what the program will entail, what to look forward to every day and every week, and also how to keep track of your process. As well as setting goals, it's important to set some expectations, both from the therapist to you and from you to the therapist. What is expected of you by the therapist? What kind of exercises will you be doing in the therapy room? What kind of exercises will they want you to do when you go home? This is critical because you can't just rely on your physical therapy at the physical therapy room. Physical therapy is a 24-hour job, which includes doing your exercises, eating correctly, sleeping well, among other things. Knowing what's expected of the therapist is also important. That way you know that you are not fully responsible for this process and that you do have someone there with you. And finally, the last expectation that you should set with your therapist or your athletic trainer is knowing around how long the therapy will take. As well as setting goals and expectations, it's also important to set some potential barriers that you may come across with and how you will get through them with some action plans. The second tip is to keep a log or a journal. In this journal, you should keep track of objective things or things that can be measured with a metric. So this is the types of exercises you're doing, how many times you're doing them each, how many reps you're doing, as well as any increases in range of motion or decreases in pain. Along with keeping track of your objective data, it's also very important to keep track of your subjective data. By this, I mean things that you can't really measure with a yardstick or by counting. More about your subjective data is more of how you're feeling. How did you feel when you're doing a certain exercise? How did you feel overall? Were there times where you're feeling frustrated or bored, or places where you were having more of a hard time going through a certain exercise? It is important here to keep track of both the metrics and your feelings, because by keeping track of your metrics, you will see day by day how your increases are going, whether it's increasing in reps or increasing in range of motion, or the subjective, like today I was able to handle it easier, or I didn't feel as frustrated or as bored while doing these exercises. With this, you can keep track of the little wins that you have throughout the day. And with these little wins, they will add up. That way, when you are having a bad day or a day that you do not feel as confident or as motivated, you can look back on your log and see all those little wins to help you motivate yourself for that day. Which leads to my third tip, visualization. Visualization is using your mind's eye or imagining something in your head as vividly and as clearly as possible. One way to use visualization in physical therapy is to prepare yourself for that day's workout. By using your logs as well as your goals and expectations, you can imagine yourself going through your physical therapy program and just practicing the different exercises that you have to do. By doing this, you're actually training your body to do those exercises. So when you get to the moment when you're actually doing them, they might feel easier or not as boring. Or even if there are moments where you do get frustrated, it's important to also visualize those moments and how you see yourself getting past them. Another way to use visualization is to help your body heal itself. This can be done by getting into a meditative or relaxed state and just visualizing your breath going to the injured area and having just some extra energy to that area. If you're interested in going more in depth with this, comment below and I'll send you a visualization audio recording that I have just for this case. And lastly, the fourth tip is to stay aware. Just by being injured, you are already a little more aware of what your limitations are, both in your sport, since you may not be doing it, or in regular life. So you're already aware of what's going on around you. But it's also very important to stay in the moment and aware while you are doing physical therapy. This is important because by staying in the moment, you're able to do the correct exercise in the correct form, the way your therapist or your athletic trainer has taught you. You're also more aware if there's any discomfort or pain and where it's coming from. And this is very important, especially when you are upgrading exercises or doing more exercises that have more impact. Because if you are distracted, you may cause yourself to get injured more or to delay the process. And finally, some techniques to help you stay in the moment or to stay more aware is keep track of your reps, count them one by one. Another one is to focus on your breath and be in the moment. And most importantly, get off your phone. Don't be on your phone while doing reps. You can save using your phone for whenever you are icing at the end of the day. So to summarize, I've given you 4 tips to help you get through your physical therapy program. First one was to sit down with your athletic trainer or a physical therapist and set goals, expectations, possible barriers, and action plans. Second one is to use a log or a journal to keep track of your objective and subjective data. Third one, using visualization to help you prepare and get through the day in physical therapy or to help your body heal itself. And the last one is to stay aware, stay in the moment, and focus on what you're doing now. Thank you for watching, and I hope this will help you get through your physical therapy program with less frustration, less boredom, a little more awareness, and hopefully come back to your sport with more confidence and less fear. If you have any questions or want more tips on how to stay mentally strong while going through an injury, don't hesitate to contact me. You can follow me at Camuwave on Instagram, Facebook, and Twitter. You can also visit our webpage at www.camuwave.com. And if you have any comments, please leave them below. Thank you.